Hey everybody, hope y'all are doing well. Dr. Bupp here at Advanced Health and Wellness Center, and today I'm going to try to keep it simple. We're going to talk about gardening, flower beds, mulching, all those kind of things. We've been seeing a lot of patients that have been having some lower back trouble because they've been spending a lot of time either raking or cleaning up the gardens or actually doing things in the garden. As you can see, the weather is not great for that today, but it's supposed to be nice this weekend, so I'm sure a lot of you will be doing some of those things. And so the main thing, the first thing that I want to talk about just is that we have this neutral spinal position. A C curve in the lumbar spine is the thing that protects us and also gives us stability. So the curves in the spine create function. When we have proper function, we have proper stability and strength, and then we don't have pain. So when we want to make sure that we're protecting ourselves, we want to make sure that we have a good curve, lumbar curve, okay? Lumbar curve, lumbar curve, lumbar curve. So when we're doing things in the garden, or we're mulching, or we're doing whatever it is that we're doing, this becomes a really bad position. Okay, so when we're bent over and we're doing weeds, or we're bent over and we're mulching and we're doing this, that's going to be a strenuous position for the spine because we're compressing the discs and we're making the body work a lot harder than we want. So really what we want to be able to do is get down to kind of a ground level, so to speak. Maybe on one knee if it's possible for you to do that. Two knees if you're able to do that as well. And then we go from this position with a strong lower back. Core tight, lower back activated, glutes activated, and we're here, working here. If you're not able to get down on a knee, then we're going to try to get into a position like this, okay? And then we're going to pull weeds, or we're going to do whatever it is that we're doing. But if you can see, Matt, if you get low there, you can see my back is still in a flat position, okay? So this, remember, this rounded creates trouble. So I'm going to do something to allow me to still be down. I can't get down on my knees, so this is better, okay? I can't get down on my knees because my knees hurt or something. Then I'm going to get in this position, and I can actually use my elbows here to support me. So that's the key, is keeping that neutral spine. So what happens if you do have some pain? There's some exercises, some stretches. So the most basic kind of things to do here is going to be person laying on their back, and we're going to bring the right knee over to the left shoulder there, and I'm just pulling that up and creating a stretch down here in my glutes and in my lower back. So I don't want to do a lot of twisting. You can bring it across and stretch here, but again, this has an X through it because we can overstrain the spine that way. So we're just gonna go here, and then we're gonna do, that's gonna be for a minute, and then we're gonna go this way and do the same thing, and we're bringing that across to the opposite shoulder, and then we're going to do the cannonball stretch. So on my back here, I'm going to pull my knees up to my chest, okay? And I'm going to hold that. Now if I have somebody that can help me, they can put their chest on my feet and then push this way, and that will also give me a stretch. So we got right leg, left leg, both legs, all for a minute. We can activate our core by tucking our pelvis here under. So it goes from here to under, and that would be like if I was trying to push my back into the table. So I couldn't get my hand out over here. So I'm gonna go here, I'm gonna push this down and create that kind of pressure, but that's tipping my pelvis back under there, and that gives us some core strengthening as well, okay? And then the last one is this, what we call cat, cow. So you know a scared cat does this, okay? So we're gonna go cat, up, round it, and then we're gonna let it sag and relax, okay? And just I'm trying to let my belly kind of spread my legs apart so I can, whatever feels comfortable, I'm just gonna let my belly sag. And it should feel good, like these should feel good. If they don't feel good, then don't do it. And then the other thing I'm gonna do is round this way, like a cat, and again, back and forth, okay? So I'm gonna go round 10 seconds, and then let it sag. And I like to do this where I let it sag for like 30 seconds, 45 seconds, and then I'm gonna round it again and hold it for 10, and then let it sag, and then round it again for 10 seconds. And you can do that multiple times. Start with 3, 4, 5 times, whatever. The thing that's really important with this is if you're experiencing back pain, a lot of times that means that there's biomechanical dysfunction. So what I want to tell you, the most significant thing to us is you can have intermittent back pain that doesn't cause constant pain, but is actually degenerating, or the spine is deteriorating faster than it should be because it's dysfunctional. So it's really important that somebody had their spine checked and that we look at the alignment and the motion. So of the actual spine, all those things that I was doing there will give you some relief from a stretching standpoint. I'm trying to be nice and helpful, but I don't want that to take the place of actually having a spinal evaluation by a professional. Too many people discount lower back pain and think, well, it'll go away, or usually it goes away, or I can do those stretches that Dr. Bupp showed us and it gives us some relief, gives me some relief, and then it happens again, and then it happens again. And then we look at the x-rays and it's like the person's having more and more degeneration or deterioration of their spine, and that is setting you up for more problems and not being able to do the things you want to do. And so you do need to have more of a full evaluation as well as a treatment plan to get better function in the spine, motion and alignment, so that it can be corrected versus having to do stretches when it hurts. All right, so pay attention to that posture, the way that we're working, a couple stretches for you to do. But guys, lower back pain is the #1 cause of disability in the United States, and our success rate is extremely, extremely high for helping people with lower back pain. So if you know somebody, please send this to them. There's no reason to be suffering with pain, and definitely surgery should not be a first option. There's complications, and it's a lot of times not effective. So there's other options first. Otherwise, hopefully that's helpful. Have a great weekend. Get some sunshine, breathe some fresh air, and we'll see you guys soon.